Welcome back, everyone. You're watching sqadia.com, and we were talking about the musculoskeletal system. My name is Muhammad Osama, and the section that we are going to talk about right now is the diseases of the bones. So the topics that we're going to cover in this section include osteomyelitis, osteoporosis, Paget's disease, osteomalacia and rickets, and fractures. So first of all, let's talk about the osteomyelitis. As the name indicates, has something to do with inflammation, and inflammation is also accompanied in conditions where there is infection. So actually, osteomyelitis is the infection of the bone. And why is it infection of the bone? Because bones are a metabolically active part of our body. There is a lot of blood supply, and thus there is chances of infection as well. The most common agent which can cause osteomyelitis is actually a bacteria which is known as Staphylococcus aureus. Other bacteria which can result in osteomyelitis include Haemophilus influenzae and Salmonella. The symptoms of osteomyelitis include fever and local pain where there is the infection, arrhythmia, and you can note arrhythmia by the redness of the skin, and sinus formation or abscess formation because there is an infection. And these are all the symptoms which the patient would present to you with in chronic osteomyelitis. Here you can see in this x-ray as well, there is this sinus formation in the osteomyelitis, which is indicating that there is an infection here perhaps. The second condition, which is also a very common condition in the elderly population, is osteoporosis. As the name indicates, osteo means bones and porosis means porous or something which has a lot of holes in it, which means it has something to do with the density of the bone. So osteoporosis is a condition in which the mineral density of the bone is decreased and the bones are porous. So decrease in density of bone resulting in porous, weak or fragile bones. This is known as osteoporosis. Now, when the bones are weak, what would happen? First of all, we need to know the function of the bones. The function of the bones is support to carry out weight, especially in the weight-bearing parts of our body, such as our spine, such as the lower extremities like femur and tibia. So when the bones are weak and porous, so when the weight is applied on such bones, then they are more prone to have a compression fracture. Similarly, a weaker bone is more likely to have a fracture in response to trauma as well. So these bones, or the osteoporotic bones, are more, you can say, at the risk of having fractures. There's also another condition which is known as osteopenia. The name is also somewhat similar to osteoporosis, and it is also a condition which resembles osteoporosis, and that is also related to the decreased mineral density or decreased density of the bone in general. But the difference is that in osteopenia, what happens is that there is a slightly less dense than the normal bone, whereas in osteoporosis is a more severe form in which there is a greater degree of decreased mineral density. The very common test which is performed for diagnosing osteoporosis are the DEXA scans, and which can tell you about the mineral density of the bone. And here you can also see it is a X-ray of the lumbar spine. This is L5, L4, L3, L2, and L1. Here you can see that there is actually, because this part is osteoporotic and it is at the risk of developing compression fracture. The second condition is the Paget's disease. It is also a condition of the bones, but the difference is that it is metabolic in nature. The pathophysiology is related to the metabolism. So what happens is that whenever there is an interference with the normal body's recycling process of the bones, what happens is that In the normal condition, there is normal trauma, which is a habitual trauma, which is occurring at the bone. So there is trauma to the bone, and then there's a healing process as well. So this healing should be very optimal for the optimal health of the bones. But in Paget's disease, there is actually a disruption of this recycling process of the bone, which is a process of mineralization and demineralization. And because of this abnormal process, as the time passes, the bones become weak and fragile because they are not properly remineralized, they are not properly healed, and they also misshapen. As you can see, this picture, there's actually bowing of this leg. And you can see this leg, it is not straight as compared to this one. Here the femur has bent because of being fragile or being weak, and it cannot properly bear weight as well, which also involves the knee joint and hip joint, because the stress or the weight is not normally transmitted from the spine, from the hip to the knee, which predisposes it to greater levels of stress, and a person can develop knee pain and even osteoarthritis in the longer run. What you can see in this condition are actually elevated levels of alkaline phosphatase in the blood. The most commonly involved areas in the Paget's disease are the skull, the pelvis, the spine, and the lower extremities. In the Paget's disease, there's actually a rapid remodeling, and because of that rapid remodeling, it does not get sufficient time to properly repair the bones. So there is softer and weaker bones, fragile bones, as I just said, and it can lead to sometimes bone pain as well, which would be diffuse. And in the longer run, deformities and fractures, because at the end the bones are weak. And as I already said, because of the misshaping bones, then there can be increased stress on the weight-bearing joints as well. So here you can see in Paget's disease, because of the abnormal remodeling process, this is a part of this bone is less opaque as compared to this, so which means it is more fragile and prone to fracture. And here you can see there is this bone tibia, and it has bent. It is like a bowstring, and which would actually result in abnormal stress at the knee joint and the ankle joint, because all of the joints actually participate in an osteokinematic chain to transfer weight from one joint to the other. Now, another condition is osteomalacia and rickets. It is somewhat similar to osteoporosis, because here we are also talking about the softening of the bones. And in the softening of the bones, it results from a defect in the bone maturing process. And the cause here is actually the calcium and vitamin D deficiency. And what does vitamin D deficiency do? Is actually, we know that calcium is one of the most important inorganic components of the bone. And when there is absence or deficiency of vitamin D, then there is decreased absorption of calcium from the alimentary canal. Even though if there is sufficient calcium in the diet, the person is not able to absorb the calcium without the vitamin D. So vitamin D is very important. It should also be a part of a regular diet. And another important source for vitamin D is sunlight. So if a person is exposed to a little bit of sunlight every day, he would also be able to have normal levels of vitamin D. So what happens in this condition, there is actually bowing of legs during growth, especially in rickets, because rickets is in children and osteomalacia is in adults, and especially in the weight-bearing bones of the lower extremity, such as tibia and femur. And you can also see here, so there is actually bowing of the knees. This is a bowing deformity, which is in which you can see there is actually bowing of the femur as well as the tibia. And there would be, if a person is standing with this deformity, you would see that there is a more than normal gap between the two knees. Some other causes for osteomalacia and rickets include surgeries, celiac disease, kidney or liver disease, because all of these results in either increased, you can say, loss of calcium or decreased absorption of calcium. So these can be a risk factor for developing osteomalacia or rickets. Now, another thing that we're going to talk about is the fractures, which are very common. We see a lot of patients every day which are presenting with fractures, and we have to understand what are the different types of fractures. So let's talk about it. So we have transverse fractures, which are in a horizontal line. You would see a horizontal slit on the x-ray. There's oblique fracture, which would be inclined at an angle on the x-ray when we observe them. There are spiral fractures, which are caused by the rotational stress. And we will see comminuted fractures, which have a lot of fragments. There would be segmental fractures in which we would see that there would be a specific segment which would be separated from the longitudinal axis of the bone. And there would be avulsion fractures, which are actually because of the increased muscular action, which detaches a part of the bone at its point of insertion, which is known as the insertion of the muscle. And impacted fractures, which are actually because sort of compression fractures. And torus fractures, we will also see the torus fractures, and green stick fractures, which are more common in the children. So let's look at this picture. What do you see here is there is actually a separation of a part of the proximal aspect of the tibia, which is actually because of the pull of the quadriceps muscles through the patellar tendon here. So this tendon actually, because of the contraction of the quadriceps, pulled a part of the tibia with itself, and this is known as an avulsion fracture. Here you can see because of the compression impact, so this is an impacted fracture at the femur, and here you can see there are a lot of small fragments, so this one is a comminuted fracture. And then here you can see this is the wrist joint, and this is here you can see a impacted, sorry, not an impacted fracture. Here we have a torus fracture. This is a torus fracture. And here you can see we have a separate segment in the longitudinal axis of the bone. So this is a segmental fracture. Now here we can see this is oblique as well as a spiral fracture, because there's also a component of rotation. Similarly, this is also an oblique and spiral fracture. This is what you call a green stick fracture, which is very common in the children. And here you can see a transverse fracture because the slit is in the horizontal line. It is a horizontal line on the x-ray. So what we learned in this section of the musculoskeletal system was osteomyelitis and osteoporosis, Paget's disease, osteomalacia, rickets, and different types of fractures. So I hope it was beneficial for you, and do watch the upcoming sections of the musculoskeletal system. Thank you for watching. sqadia.com.